Tonight, America puts a weary and watchful eye on a new COVID-19 variant first spotted in South Africa and recently flagged just north of the border in Canada. Omicron is what they're calling it, and there's something about it that has top epidemiologists concerned. Lots of questions, but there are some answers out there, and Christian Garzone went searching for them tonight. He joins us in the newsroom with more. Christian.
Well, Adam, we're still learning about this new variant, and we're told it's going to be a couple weeks of intense lab work to figure out a few things: how deadly it is, who the virus infects, and what remedies we have to fight it. For now, doctors believe the vaccines can provide protection. The Omicron variant of COVID-19 was only detected on November 9th and first reported on the 25th in South Africa. Dr. Ann Falsey with URMC says what we know about it is still minimal.
So there are many questions, and it's very new.
Falsey says many concerns are arising. Is Omicron more severe? Is it more transmissible?
And importantly, will the current vaccine still offer protection? Will it be impacted at all?
She says a lot of smart people are working very rapidly in the lab to answer these questions. Dr. Angela Branch says we need to figure out who is getting infected.
Is it vaccinating individuals? Is it people who have gotten COVID and recovered? Is it entirely unvaccinated people?
Also to take blood from people who have recovered to see if their antibodies can neutralize the virus. Pediatrician Dr. Ed Lewis says what we're hearing out of South Africa is that it's more transmissible than Delta.
When you look at how quickly these are popping up in other countries, it's probably already here.
Lewis says vaccinated or not, wear a mask.
People need to enjoy the holidays, but enjoy them with caution.
URMC says viruses like COVID mutate to survive. They hope the more get vaccinated, the less mutations COVID will see. For now, Dr. Branch says the message is still the same.
Get as many people vaccinated as soon as possible.
And Dr. Falsey says coronavirus and its mutations are likely something that unfortunately will be with us going forward. The key is to limit transmissibility. Live in the newsroom, Christian Garzone, News 8. Adam, back to you.
All right, Christian, thank you. Now, these concerns come as New York State and the nation prepare for a likely post-Thanksgiving COVID spike. Governor Hochul says she anticipates a surge of hospitalizations roughly 10 days from now as a result. She adds this is especially concerning since many hospital systems upstate, including those here in the Finger Lakes region, are nearing capacity. To try and change this, she recently signed an executive order allowing the state health department to limit non-essential surgeries if needed to open up capacity. This order goes into effect on Friday.
That's why we took strong, decisive action at this time to deal with a situation that is manageable upstate, but to make sure that it doesn't spread like wildfire and get out of control in light of this new variant certainly coming to our shores if it's not here already.
Hochul adds that some healthcare workers downstate in areas with more hospital capacity will help healthcare staff in hotspot areas. Now, the latest numbers are in for Monroe County. 7 more people have died from COVID-19. Those deaths happened between November 12th and the 21st. This comes alongside 270 new cases reported today. Our positivity rate stands at 8.8%. 429 people are in the hospital with the virus tonight in the Finger Lakes region, and 104 of those patients are in the ICU.